Welcome to my world, the world of the medical laboratory scientist. Health is wealth, knowledge is power. Essential hypertension and hemorrhagic stroke. This topic came as a result of a mere question on somebody that what cause is hemorrhagic stroke, and my friend, a colleague who happens to be the chairman of the Association of Medical Laboratory Scientists said that the stress in this country is too much. And I said, that must be the non-traumatic hemorrhagic brain injury, where you now experience the blood pressure, the blood vessel itself tearing or bursting in the brain, and therefore the brain, as I have shown in the earlier video on traumatic brain injury, should not have any blood touching the brain. So now when the blood vessels of the brain breaks through because of the hypertension, because the blood pressure, the vessels have been weakened, have been so no longer elastic. The higher the pressure, now it cannot really expand, and so it breaks, and that breakage is what is causing that hemorrhagic injury. And there are what we call that injury is now what is called hemorrhagic stroke. There are so many, or at least 3 types of stroke. One is the one of the brain or from the heart, called ischemic hemorrhagic stroke, while this one is just the brain, the hemorrhagic stroke itself. So what we are now going to understand more is what role as medical laboratory scientists got to play in this hypertension and hemorrhagic stroke episode. The medical laboratory scientist has a great role to play, because we know that when you are talking of hypertension, you are more or less talking in terms of the blood pressure that has been consistently high. And when you are talking of essential hypertension, you are now talking of those inclinated in age, because of the age of the person, the genetic makeup of the person, the lifestyle. So once this essential hypertension is discovered, it is like a lifelong. It only by continuous treatment of these taking drugs, maintaining a lifestyle prescribed for you, and your age, you cannot do anything about your age, but you can do exercises to age less instead of aging quickly. So the role the medical laboratory scientists will now play is in checking the variables that would affect your blood pressure. For example, you could be talking about stress. Then there is the cortisol hormone that could be checked. And when you are now talking of the person already have been experiencing the hemorrhagic stroke, what other tests? The electrolyte test and could be done. And all these I shall expose more in the slide section. So as we journey into the slide section, like I used to say, click the like button, subscribe, and more will be exposed to you. The outline: objective introduction, warning sign of stroke, laboratory diagnosis, and recommendations. The objective: to create more awareness of essential hypertension, its causal relationship with hemorrhagic stroke, the warning signs, and how the medical laboratory scientists can help in their prevention and control. The introduction: hypertension is a chronic condition that shows a consistently high blood pressure over 130/80. The older one gets, the more likelihood it reaches 140/90 or more blood pressure measurement, especially the primary hypertension, also called essential hypertension, that is linked to age, genetic makeup, and lifestyle. The secondary hypertension is curable because once you are able to remove the causative what caused it, it will now come back to normal. Usually, the kidney, nodules, and what have you. Its normal value is at 120 to 80 millimeter mercury. Well, the stage 1 hypertension is when it's over 130 and the diastolic is over 80 or close to 89. Stage 2 is 140 over 90 or 140 over 100 millimeter mercury. Then the hypertensive crisis is when it is 100 to 180 to over 120 millimeter mercury. At the crisis stage, if not controlled, it could lead to heart disease, stroke, and kidney failure. If the vessel erupts in the brain, it causes hemorrhagic stroke. Now to the warning signs of stroke. The truth is, hypertension is the high blood pressure. You may not really know that you have hypertension until when the various complaints, sickness, rears it, and you are now advised to really check your blood pressure, especially when you have headache. Now for stroke 2, the headache that comes, it comes on suddenly and seemingly without cause. Then there is the numbness of weakness, confusion or trouble speaking, dizziness or trouble walking, sudden vision problem. It is a medical emergency, which means straight to the hospital emergency section. Up to 90% of stroke are linked to 10 modifiable risk factors, with high blood pressure, hypertension being the leading cause. Key causes include smoking, diabetes, high cholesterol, obesity, and heart conditions like arterial fibrillation. Hemorrhagic stroke occurs when a blood vessel bursts inside the brain. Yeah, the laboratory diagnosis. Apart from checking all those variables that usually is called this metabolic syndrome test, where you want to check for the fasting blood glucose and all the tests that could help prevent the occlusions of the blood vessels and also increase blood pressure. Once there is this stroke, hemorrhagic stroke, the only way to confirm that it's hemorrhagic stroke and not ischemic stroke is the computed tomography scan. That's the gold standard. And after confirmation, specific laboratory blood tests are done immediately to manage the patient and assess clotting ability. Because if it is hemorrhagic problem, it could be that the clotting, the platelets and clots formations are because once there is that burst, you must have clots. The mechanism is there. So the test performed is coagulation study. Is done to identify if the stroke was caused by or will be complicated by anticoagulants, blood thinners, medication. So one should be also careful about blood thinners when you use them, because these are the complications that can come in. Then you can also do the complete blood count, lumbar puncture in case you suspect subarachnoid hemorrhage. Then there are metabolic panel and toxicology screening when you are suspecting this cocaine use or amphetamine, so on and so forth. Now, finally, the recommendation. The causal relationship between essential hypertension and stroke has been established. So, there is no doubt that once you don't manage your hypertension, invariably it will lead on to hemorrhagic stroke, especially when it's essential, the primary type of hypertension. All we need to do to prevent it is to avoid the risk factor of hypertension. So, you may not be able to know that you are hypertensive But this regular blood pressure check will help one to know. And once you have confirmed that you are hypertensive, then you need to do certain things. They change your lifestyle, the age. So we should slow down our aging process, because age is a very big factor. By eating right, possibly mimicking Mediterranean diet, doing exercises, avoid smoking, drinking occasionally and reasonably, perform routine blood pressure check and some check on metabolic syndrome parameter. And I believe hemorrhagic stroke will be very, very far away from us. Like I've always been saying, click on the like button, subscribe, invite more people. There are so many videos on the laboratory importance of in health matters on this channel. Thanks for watching.